Conflicts of interest in medicine, when doctors, patients, and conditions just can't get along. Hello and welcome to the channel. In today's video, I share my frustrations regarding an unnerving problem that doctors and patients alike face all the time. It's a feature, not a bug, of medicine. What do I mean? You see, medicine is a bit like cooking. You've got all these ingredients, drugs, treatments, conditions, and patients, interacting in sometimes predictable, often confusing ways. And just like in cooking, when you throw in too many flavors, things can go horribly wrong. Take conflict of interest, for example. It's like trying to make a souffle while your oven is on strike. Today, we're diving into some of the more complex and paradoxical scenarios in medicine where conditions and treatments have the audacity to disagree with each other. These are the cases where your bleeding risk argues with your thrombosis risk, your heart failure decides to show up at a kidney failure party, and your leg edema or swelling has a secret, ongoing feud with dehydration. In medicine, these are the conflicts of interest that give doctors a headache, patients a panic attack, and medical students their first existential crisis. Let's start with bleeding risk versus thrombosis, a dance of death and clotting. Let's start with a classic, the battle between bleeding risk and thrombosis, also known as blood clots. It's like a reality TV show that never ends. On one hand, you have people who are clotting machines, forming blood clots at the drop of a hat, or shall we say, at the drop of a stent. A stent being a little metal device put in an artery to relieve a blood clot, to unblock it. These are usually put in the arteries of the leg or in the heart, in the coronary blood vessels of the heart. On the other hand, you have the bleeders, those whose blood thinks it's a little too good at its job, pouring out of every orifice like it's auditioning for a part in a horror movie. Take, for example, someone on anticoagulants, blood thinners, like warfarin or the new fancy drug dabigatran. These are the people who take a pill to stop the blood from doing what it naturally does, clotting. It's all fun and games until they get a paper cut and end up in the emergency room. Doctors have a delicate balancing act. They want to prevent the catastrophic event of a clot, like a stroke or a deep vein thrombosis in the leg, or even worse, a pulmonary embolus, where the deep vein thrombosis in the leg travels up to the lungs to cause a pulmonary embolus or a lung blood clot, which is life-threatening. But the doctors also don't want their patients to bleed out from a sneeze. Here is the kicker. You can't always win. It's a fight where one side must lose. And more often than not, it's your liver that gets stuck in the middle, trying to regulate everything like a very stressed out middle manager. Now imagine this, a patient with both a blood clotting disorder, say factor V Leiden, and a tendency to bleed out, like a scene from The Walking Dead. The doctor's job? Good luck. You're caught between the devil and the deep blue sea, trying to figure out which drug will either stop the patient from dying from a clot or prevent them from turning into a human fountain of blood. So what's a doctor to do? It's all about finding the sweet spot in the middle. Think of it like trying to balance your blood pressure on a tightrope. Too much anticoagulation and you're looking at a bruising bonanza. Too little and your veins turn into highways for clots. It's a constant gamble. But hey, at least It makes the Grey's Anatomy plot lines look tame. I just had this very problem to deal with not so long ago. An adorable patient of mine had really bad knee arthritis, but he also had the heart rhythm issue called atrial fibrillation, where his heart's small chambers or atria beat chaotically or not at all sometimes, increasing his risk of having a stroke because with a poorly coordinated atria beating randomly or chaotically, the chances of blood clots forming in them is high, and from time to time one of these little clots can go up through the blood vessels up going to the brain and block one of the brain arteries, causing a stroke. So patients like this must have their blood thinned with an anticoagulant medication or risk having a massive stroke. One day he came to me begging for pain relief for his knee pain. His orthopedic doctors had already ruled out a knee replacement surgery. Basically, he was unfortunately too old for such a big operation. It was just too risky. So now the only useful pain relieving strategy for him was a knee infiltration or injection with steroids or hyaluronic acid or some such substance. Even his own blood, where we spin the blood, centrifuge it, and tease out the growth factors so that he could have an auto injection of his own blood in a procedure called PRP therapy or platelet-rich plasma therapy or injections or infiltrations. And here lies the problem. Do they take the risk to inject his knee while he's still taking a blood thinner for his atrial fibrillation? Or do we stop the blood thinner for a few days in the hope that when they do the injection, his blood is not so thin that it bleeds into his knee? The surgeons took the latter option. They stopped his anticoagulation for a few days and injected his knee with steroids, and he got immediate relief. He could walk again, dance again, work in his allotment again. Except 2 days later, he got a stroke. The story ends well in this case. I am pleased to report that he has recovered very well from his stroke. He was promptly treated and everything turned out well. But we will never again take the risk to inject his knee again. If he gets his knee pain back, he knows not to even ask us to do something about it invasively. We will have to give him strong painkillers and leave it at that. Here's another conflict I wanted to discuss in this video, and that is heart failure versus kidney failure. A tale of two organs that just won't get along. Imagine this scenario. Your heart is overworked, tired, and trying its best to keep things pumping. It's like one person in a group project who does all the work and is still ignored. Meanwhile, the kidneys are slacking off, unable to filter out all the fluids, and suddenly you're drowning in a sea of water retention. What could possibly go wrong? When it comes to heart failure and kidney failure, these two organs often form an alliance, and not in a good way. In fact, it's the worst possible team-up. The heart is struggling to pump blood effectively, causing fluid to back up in the lungs and tissues. The kidneys, those little bean-shaped troublemakers, are responsible for cleaning the blood and filtering out excess fluid. But when the heart's not pumping properly, the kidneys can't filter, and fluid builds up like a nasty waterlogged basement. Now you've got a classic case of congestive heart failure with renal insufficiency, a condition where both the heart and kidneys are underperforming, yet somehow managing to make each other's life harder. And then, just for fun, throw in some diuretics, the water pills, to try and fix the situation. Diuretics help remove excess fluid, by making you pee like a racehorse. Sounds great, right? Except the kidneys are already struggling, and now you're telling them to work even harder. It's like telling someone who's running on fumes to run a marathon. But wait, there's more. The diuretics themselves can cause so-called electrolyte imbalances, blood minerals imbalances, which may make the heart even more grumpy. Low potassium levels, for instance, can lead to arrhythmias, heart rhythm problems. And we all know the hearts with bad attitudes don't play nice. So now the heart, already pissed off at the kidneys, starts throwing tantrums. And the kidneys are like, hey, I can't help you when you're dehydrated. This is a mess. What's the answer? Well, for doctors, it's all about minimizing the damage limitation. You might give medications to try and help the heart pump better while cautiously managing the kidney's workload. It's like being a referee in an MMA fight where both opponents are using the same technique. But it's not always a perfect solution. In the end, the body is like an over-caffeinated committee meeting. Lots of people trying to talk at once and no one listening. Poor kidney function leads to fluid buildup, worsening heart failure, and vice versa. At this point, the patient is basically in a tug of war between their heart and their kidneys, both of which are equally pissed off and not willing to let go. In my days as a hospital-based cardiologist, this conflict gave me nightmares every day. It was my bread and butter, frustrating, doesn't even begin to describe it. Conflict number 3, leg edema versus dehydration, the battle of fluid imbalances. Now let's talk about leg edema and dehydration, which may sound like an odd pairing, but trust me, they can coexist in a most ridiculous way. Edema is the fancy term for swelling, fluid pooling in the tissues like an uninvited guest at a party who refuses to leave. Dehydration, on the other hand, is the opposite. It's when your body is crying out for water, like a houseplant left too long in the sun. So, how can these two conditions possibly be at odds? Like any great paradox, it's because the body is complicated, confusing, and occasionally loves to make a doctor look foolish. Here's the thing. You might think that someone with leg edema is clearly drowning in fluid, right? That should mean they're hydrated, no? Wrong. Fluid in the tissues isn't the same as fluid in the bloodstream. Dehydration happens when you don't have enough water in your circulatory system, in your bloodstream, to maintain normal function like your blood pressure, heart function, etc. When you're dehydrated, your body does its best impression of a hoarder. It holds on to what it has, packing away the water in the form of swelling, like a squirrel stashing nuts in every nook and cranny. So now you have the ultimate showdown. You've got a patient with swollen legs due to fluid retention, aka edema, but when you try to hydrate them to relieve that swelling, their kidneys, remember those guys, start acting up and retaining even more fluid. What's a doctor to do? Prescribe diuretics to reduce the swelling? But those same diuretics can worsen dehydration because they'll make the patient pee out every drop of water in their system. Hydration versus fluid loss. It's a conflict of interest in the most literal sense. The answer, you guessed it, a balancing act. You can't just give someone with edema all the water in the world and expect the swelling to go down. Sometimes it's a slow game of rehydration combined with careful management of the underlying cause of the edema, whether that's heart failure, kidney problems, or something else. You may need to walk the tightrope between hydrating the patient without making their legs look like two overinflated balloons. No pressure, right? In the world of medicine, conflict of interest is not just about pharmaceutical companies and doctors having a business deal on the side. It's about how different diseases, treatments, and conditions interact with one another in ways that make doctors feel like they're juggling flaming swords while riding a unicycle. Patients often arrive at the doctor's office with complex, interconnected problems, each one pulling them in a different direction. The medical team must be diplomats, negotiators, and part-time problem solvers, all at the same time. And while we joke about the absurdity of some of these conflicts, who thought up kidney-heart warfare? It's no laughing matter when those issues actually occur. But here's the good news. Doctors are trained to handle these chaos or chaotic situations. They have the knowledge, hopefully, the tools, and the nerve to navigate through it all. So while you may end up with a few more gray hairs by the end of a shift, at least I did, at least you have a few tricks up your sleeve that you can deploy in this hot mess of a situation. And in its most simple form, such conflicts of interest do not necessarily even have to be about organs of the body or about medications. Sometimes it's to do with something as simple as giving nutritional advice. I'll give you a nice example. When I have patients who are vegetarians, for example, and therefore don't eat meat, who need, therefore, plant proteins and non-meat, at least, proteins. So milk, cheese, maybe even eggs, if they are the type of vegetarian that eats eggs. But on the other hand, they have a high blood cholesterol level, so they must watch their egg intake because eggs contain a high amount of cholesterol. What do you do with such patients? Milk, especially normal percentage of milk or whole milk, which contains a high amount of fat and therefore cholesterol, may not be appropriate. Often these patients don't want to take medications, so then dietary management of their cholesterol becomes very important. How do you manage this situation? It's a conflict. There are conflicts everywhere. Maybe it's just me. So what have we learned from all these ridiculous, mind-boggling conflicts of interest in medicine? Well, first we've learned that the human body is a bit like a dysfunctional family reunion. There's always one organ that's acting out, one that's slacking off, and another trying to keep everything together. But more importantly, we've learned that doctors are part of this mess, trying to figure out how to keep it all under control while making sure no one gets their feelings hurt or, deletes themselves, which is, of course, an outcome that no doctor wants for their patient. In the end, medicine is about finding balance, because in the world of blood clots, swollen legs, and uncooperative organs, everything is a game of give and take. The real conflict of interest isn't just about what treatments to give, it's about figuring out how to make the whole body play nice together. And while doctors may never win every fight, they're usually pretty good at managing the chaos, at least until the next conflict of interest rears its ugly head. So next time you see a doctor, give them a high five for surviving the daily battles between clots, fluid retention, and organ rebellions. It's a tough job, but someone's got to do it. And in the end, they'll probably give you a prescription for rest and fluids and call it a day. Just kidding. This whole video sounds like one big promo for doctors. It's not. The goal here is to educate the audience and give insights into the challenges that doctors acting on your behalf might face in treating your various ailments. It's a secret peek into your medical records. You are welcome. To thank me, do subscribe and like this video, and stay tuned for more educational and hopefully entertaining content on medical issues. If you have any specific questions to ask me, don't hesitate at all. Just ask a doc.